Welcome to Your Doctor Wants to Quit, a podcast inspired by the need to save healthcare in America. I am Dr. Joy, a board-certified emergency physician, and I created this podcast to shed light on the challenges our healthcare system is facing through the multiple lenses of doctors, other healthcare professionals, and patients. By listening and working together, I believe we can fix healthcare in America for all of us.
One of the most challenging things about naturopathic recommendations is a lot of times it's just not the same language. And so there's not the familiarity around the herb or the supplement. And I think if we had the opportunity to collaborate more, to send my notes, to explain my thought process, I am evidence-based.
I don't feel that either of us thinks that our particular field of medicine fully encompasses the complexity of the human body, and that there's room for more than one type of doctor to help.
That's naturopath Dr. Alyssa Burnham and her husband, general surgeon Dr. Michael Turner. As a married couple, they have cultivated a deep respect and appreciation for each other's distinct and important skill sets, which exist on opposite ends of the healthcare spectrum. They set the example of how these two distinct worlds can coexist and even collaborate in the best interest of patients.
I'm Alyssa Burnham. I'm a naturopathic doctor. We're often referred to as NDs for naturopathic doctor as opposed to MD for medical doctor or DO for osteopathic doctor. We do a 4-year doctorate in naturopathic medicine, and we are not required to do a residency, but I did a 2-year residency at UCI afterward. And depending on where you practice, the licensure varies by state, but I trained in Oregon where we're considered primary care. So I had full scope of practice, full prescriptive rights, did residency in California where we are somewhat more limited, but I've worked with medical doctors down here. So my scope essentially didn't really change, but we also focus a lot on preventative medicine. So things like dietary and lifestyle modifications in conjunction with nutraceuticals, supplements, botanical medicine, in conjunction to prescriptions. So in a way, it's a very, in my opinion, more holistic approach to the patient because you're talking about really, hopefully, their entire health picture versus, just one specific symptom. I consider myself a general naturopath, so I see a lot of different types of conditions, but I specialize most probably in integrative women's health with a special interest in bioidentical hormone replacement therapy.
My name is Michael Turner. I did my undergrad in Oregon. I did medical school at Oregon Health and Science University, and I'm currently a chief resident in the general surgery residency program at UC San Diego. I've always wanted to help people, which I know is such a generic cliche answer, but it's also, for me, the most honest answer. I really did not like school. And so I think when I was in my early 20s, my mom's like, maybe you should look into medicine. I'm like, I never want to be a doctor. I never want to go back to school. I just graduated college. Not for me. But as I got a little older and I had some time to really think about what I want to do with my life, helping people has always been the constant. I enjoy a challenge and something to strive to and push myself against. And I like working with a team. And so in so many ways, medicine fits all those boxes. And so in my mid-20s, I just had this moment where I want to run towards what I love and not away from what I hated. And so I had to go back and did a lot more school to become a doctor. But 7 more years of training is a small price to pay for a chance to do something that you love for the rest of your life.
For me, I would say that I have known medicine or healthcare in some capacity for a long time. There wasn't ever really a doubt that I was going to go into healthcare. I didn't necessarily know what role. My mother, as a nurse practitioner, was really probably the only close person to me that was in medicine. And she was very functional and integrative minded really from the get-go. I mean, growing up, we had rice milk in the box in 2008 when nobody else was drinking that. It was very gross. To this day, I can't do it. But I think growing up in that environment, I always sort of thought about health from a more integrative perspective. And so kind of without knowing it, I studied, I did the undergrad in biology, I did the pre-med coursework. And then when I started actually shadowing providers in the field, I had a hard time resonating with some of the conventional providers, just in the sense that I didn't always feel like they talked about the things that I also thought mattered. A lot of times because they simply just didn't have the time. My first job after undergrad, I was a cardiovascular monitoring technician. And so basically we were helping anesthesia with all their lines. We were doing perfusion assist. I was doing balloon pumps in the cath lab. I mean, it was a very interesting job looking back, and it was a lot of pre-med kids like trying to go to med school and getting their experience before they go. And it was great in the sense that I saw a lot of very cool things that I think a lot of people at that age don't necessarily get to experience. But I didn't love it, and I didn't love the maximal intervention things that I was seeing, even though they were amazing and I had a lot of respect for it. But I wanted to meet people before they were getting to the point that they needed those interventions. And I wanted to focus on preventative medicine so I could help people not get to the point that they necessarily needed that type of care. And it wasn't until I shadowed a naturopathic doctor that I was like, oh, wow, the depth of what they talked about, the vulnerability that was shared, just because it's an entirely different experience, at least from my perspective, when you speak with a naturopathic doctor, because you just have more time, and the types of questions that they ask you, because the treatment options that we provide, they tend to be more layered. And so the type of options that you're offering people are usually addressing a lot of physical symptoms, but also emotional symptoms. And we're talking about lifestyle modifications, and we're getting into more specifics about diet. It's not really picking a prescription. It's not necessarily as straightforward. And so meeting that naturopathic doctor and seeing a different way of practicing and a different toolbox and options for patients was just incredibly inspiring, and also entirely new to me because I had never heard of the profession or worked with a naturopathic doctor until I was in my late 20s.
My first exposure to naturopathic medicine was in pre-med, and I was working in the emergency room as a scribe, so somebody who follows the doctors around and writes notes, because after a long 8-hour shift, to have to do 15 notes from scratch is torture. So I kind of like got the notes prepped for the doctors, and we saw a woman who had constipation issues and was taking charcoal that her ND prescribed. And my emergency room attending walks back to the office and looks at me and goes, "ND means not a doctor."
That's funny. I've actually never heard that, and I'm surprised.
One tone-deaf remark did not color Michael's perspective on naturopathic medicine. Although he went on to pursue a conventional medical career, after completing his first year of medical school, he met the person who would forever change the trajectory of his life. And when they met, she was about to begin the first year of her doctorate in naturopathy.
So we actually met the week or two after I moved to Portland, Oregon for grad school. So Michael was just starting his second year, and I was just about to start school. I don't even know that I'd had class yet. And a friend introduced us, because a lot of my family is from Oregon, which is where we were both doing school. And yeah, we just were introduced through friends. But then we proceeded to date throughout school and residency and everything thereafter. So he's been with me the whole journey, and I've been with him since the second year of med school.
When I started medical school, I said I'll do anything but surgery. So when I was a third-year medical student and doing all my clinical rotations, the one rotation that I was most excited for at the end of the day, the one rotation I couldn't wait to go back to the hospital for, the one rotation where I didn't care if I ate or slept, I just want to be doing it, was surgery. And so again, wanting to run to what I love and not away from what I hate, I chose surgery, and I think I enjoy the anatomy. I got to work with my hands. It's a very unique blend of head knowledge and practical skills. You operate on somebody and they are your patient for the rest of their lives. That really spoke to me. Somebody told me that the general surgery program at Duke had a 100% divorce rate, and they were bragging about it as a sign of how intense their training was. And I was like, anyone who's gonna brag about a divorce rate is like not my type of people. Turns out, one, that's not true about Duke, and two, a lot of people have happy, successful marriages in surgery. I'm now a proud member of that club.
It's interesting you say that about the Duke divorce rate. So I went to Mayo Medical School, and I also fell in love with surgery when I was there. I really loved working with my hands, and I just couldn't spend enough time in the OR. It was one of my favorite places to be besides the emergency department. And I worked with Dr. Farnell. He was my mentor for my 6-week surgery rotation. And at the end of my 3rd year of medical school, I sat down with him in his office and I told him I thought that I might want to apply for surgery residency. And he kind of looked at me and paused and he said, "Do you want to have a family?" So I told him, yes, I wanted to have a family. And he said, "Well, do you want to have a relationship with your kids?" And I said, "Yes." And he said, "Well, I just don't think it's going to be right for you because my wife has a totally different relationship with my kids than I do. And I feel like if I had one regret for choosing that as a career, that's what it would be, is that I just didn't spend enough time at home." Especially women in medicine, I think we're raised to believe that our generation can have it all, and it is really hard to have it all. There's always a trade-off for everything that you choose to do. I'm not sure emergency medicine was much better, to be quite honest, just with the night shifts and the schedules being not synchronized with the family schedules. It was a lot of nights and a lot of swing shifts. And so I was sleeping when the kids were awake. Like if I worked Saturday overnight, for example, it killed my Saturday and my Sunday. I didn't see my kids because I had to sleep Saturday to then work all night Saturday night into Sunday. And then I had to go to sleep when I come home Sunday. I think it's true that you can make it work no matter what your goal is. You can find a way to have a family, have a successful relationship and marriage and all of those things. But I do think that there's always going to be a trade-off. It's never going to be perfect, and sacrifices have to be made in order to make it work. And so I think it's a testament to how strong your marriage is that you have been able to make it work. It's not like you can just materialize it without trying,
I'm
Anyway.
sorry that's the advice you were given. I think that is probably what surgery was in the past, and I think that's advice trainees got, and especially female trainees, who I think speaks to some of the baked-in sexism in the field.
He was very kind to me, but maybe it was sort of in a way, like you said, like there's baked-in sexism, this idea that I couldn't be satisfied if I was not the one that was spending the majority of the time with the kids, as a woman. I don't know. But to be honest, I probably would have felt like I missed out. And some of the choices I've made later in my career were in order to spend more time with my kids. Mm-hmm. And when you're in your 20s and you're trying to make decisions that are going to affect the lifestyle you have for the rest of your life, it's hard to know how you're going to feel a decade from that moment and where your priorities are going to be. But at the same time, there's so many wonderful female surgery colleagues of mine that I can think of that are doing such great work. And even the field that I chose was very male dominated at the time. Mm-hmm. And I think that's just how it was more so back then. I finished my residency in 2012. I finished med school in 2009. So I was in med school from 2004 to 2009 because I did a MD-MPH program that was 5 years. So we're talking early 2000s. Now, 20 years later, I think things are a bit different and work hours are different and things like that. What would you both say about your experience in medical training versus your partner's experience?
We were talking about that on our drive here, and I think, and I'll let you speak to this too, honey, but I think what we landed on is that we felt like the 4-year med school experience was similar, at least in Oregon as an ND practicing in a full scope state. However, we feel like the biggest distinction came with the postdoc training and clearly our residency experiences. And then also the fact that naturopathic doctors aren't required to do a residency, but for the most part, we felt like our med schools were similar.
Did you have a normal anatomy class where you did dissection?
Yep.
And all of that?
We did, yeah.
It was pretty comparable, the anatomy?
Yeah, I would say so. Do you agree?
Yeah, I think Alyssa being the first naturopath I actually met, one thing I appreciate that was a surprise I didn't know was we had almost all the same textbooks. She just had more because in addition to allopathic medicine, she had her alternative medicine textbooks. I remember she'll be studying next to me, and like the bullet points for the lecture will be similar to the bullet points I had when I did neurology or antibiotics. And then she always just had an extra bullet point at the end of naturopathic take on it. And so going to an allopathic school while dating a naturopath, a lot of my classmates had questions about naturopathic medicine that they didn't want to ask a naturopath, so they'll just ask me. And one of them was kind of like, do they even study medicine? And I could tell them, like, they also have Netto's Book of Anatomy, which is like the classic anatomy book that all the medical students buy. So I would say, at least the preclinical basic science coursework, I thought Alyssa's training was just as rigorous as mine, which I would not have known had I not met Alyssa.
Mm-hmm. And I think maybe one of the bigger distinctions would be in the clinical rotations, right? Because did you do any hospital-based
No.
clinical rotations?
No.
I think that's probably the biggest kind of, or the beginning where it kind of starts to diverge.
Yeah.
Do you know what the rationale is as to why in a state that has full scope, is there a reason why you wouldn't do a hospital-based rotation? Is it because you wouldn't work in a hospital environment?
Probably. I think the insurance coverage piece is always kind of at the root of a lot of the ND, at least educational choices. But no, to my knowledge, I don't know that any of the programs offer that.
And you're saying it's because you think that insurance reimbursement wouldn't cover it, or med-mal for naturopathic doctors wouldn't cover hospital-based care?
Probably both, but also the only hospital, at least I know of in Oregon, that hired NDs were also acupuncturists.
Mm-hmm.
And so I think they were primarily offering acupuncture services. But that really, I think, is the only model that you could hire an ND and reimburse them.
Mm-hmm.
But even in Oregon, one of the bigger issues, and I haven't been there in a few years, but was always pay parity. So even the NDs who took insurance, the outpatient clinic setting, sometimes even that wasn't profitable because the pay parity compared to the MDs, they made more money doing cash pay.
I do think it's a little interesting that in a state where there is full scope that you wouldn't have any rotations in the hospital, because I feel like as MD candidates, we are made to work in the hospital even if we aren't planning to work in a hospital environment afterwards, just to get the experience of the higher acuity cases and to have a deeper understanding of medicine.
Yeah, I mean, I definitely think there's value to it and it should exist. I feel like I've had a lot of, just through my various work opportunities, hospital experience.
Mm-hmm.
So maybe I don't appreciate that as much for folks who haven't seen that. But yeah, I agree. I do think it should be a part of the, education experience.
Even at the Mayo Clinic, I know that they had inpatient integrative services, especially surrounding things like cancer care, post-op care, end-of-life care, things like that, where bringing in a holistic aspect of things was seen as a huge value add by patients and their families. But it wasn't really being done by naturopathic doctors. It was more like you, I think, mentioned acupuncture. I think that was pretty common, massage therapy, things of that nature.
Yeah, like more physical medicine.
Yes, more physical medicine modalities. But I do think there would be a huge opportunity to bring naturopathic care into the hospital environment in certain circumstances.
Yeah. And for a while, the Cancer Treatment Centers of America, they had an ND residency and were pretty integrated, to my understanding, for a while. I don't know if that relationship still exists, but there does seem to be, sort of in the oncology world, more of an acceptance of integrative options. That's not something I've ever really gravitated toward, but I do think that's, for whatever reason, an area that conventional tends to be more open.
Mm-hmm. Like in palliative medicine, too, in particular. Yeah. Anyway, it's unfortunate, but I do think you're right. It's probably the reimbursement model and also just the medical malpractice coverage that would limit those opportunities. And as well, just the, state by state laws that dictate how naturopaths can or cannot practice medicine in a given state, which makes it kind of difficult. What has it been like to be partnered with someone whose training background approaches medicine from a different perspective?
So I would say This is a question we get a lot. I do think that those naturopathic doctors out there who couldn't be married to surgeons, and surgeons out there who couldn't be married to NDs because they're so convinced in the certainty of their own ways. That's just not me and Alyssa. We're very open-minded. I don't feel that either of us thinks that our particular field of medicine fully encompasses the complexity of the human body, and that there's room for more than one type of doctor to help. And then just frankly, we are just operating ourselves different ends of the spectrum, where Alyssa really focuses on preventive, invasive procedures, whereas by the time you've met me, it's maximally invasive Hail Mary procedures. And so the analogy I like to give people is like, if we got a baseball player and a softball player together in the same room and want them to debate who has the better team or the better strategy. And there's a lot of similarities in the game, but it's still just two very different games. And so I feel like me and Alyssa are just playing two very different games in medicine, and there's not a whole lot of overlap.
We really do operate in such separate spaces that if you need me to talk about diet, lifestyle, versus if you break your arm or you need your gallbladder removed, those are just completely different, experiences with the medical system. And I genuinely do not believe it's either or. I think they coexist well together. And this is a good example of that, because you're not going to see me to have an organ removed, right?
And I think if we were like best friends, it may be a little juicier, but now that we're husband and wife, there's just so many other things that we need to fight and argue about. That like this philosophical, well, how should we manage gallbladder disease? I mean, it's like we just got to talk about what we did for dinner and what the kids did and whose family went for Christmas. I mean, there's just so many actual areas of like conflict and discussion that needs to happen that these philosophical debates.
Small. I will say raising children together and some of the discussions that have come up, like people will ask us about vaccine schedules. Like that's a big one, I think, that people think. But neither of us, I would say, are extremists. And so we're both very open to, we've literally sat down and have said, like, what data supports X, which one of us are talking about. Like we've sat down and we've done mini lit reviews together and have looked at the actual data that maybe I thought or he thought or whatever. And I don't know. I feel like we've changed perspective, or I've convinced you one way, or you have, made me think of something another way. I think we do a pretty good job of creating an open conversation.
That's an interesting wrinkle I've never thought about. I guess that is the one area that we do sometimes find us in conflict, is in raising kids or childbirth, because that's a field that neither of us are experts in. But we both need to have an opinion because a choice has to be made.
Well, and I think what's actually really interesting and thoughtful about your approach is that you're actually circling back to a common ground, which is, what does the data show? It's something that both of you can understand or appreciate, like looking at the research and doing an analysis of what knowledge is out there that we can rely on to make decisions, and then taking an evidence-based approach to how you make those choices together, and helping bring each other to the table, maybe by sharing those different studies that have influenced your thinking. That's really how it should be in all areas of medicine, even within the conventional world or within the naturopathic world. I feel like we should try to operate that way. And that's not to say that there isn't an artful component to medicine, because every human being is different and we can't apply the same approach to everyone, but we always want to consider the science that's out there when we are informing the decisions that we're making, and it applies in both fields. Michael, you had mentioned what your ED attending had said. ND, it means not a doctor. It's unfortunate that people have that point of view, but I think it does speak to some of the tension between integrative providers and conventional providers, and maybe some lack of understanding and lack of reaching across the aisle to work together hand in hand. And although it may not impact your relationship with each other as much, I'm curious whether your social circles have been able to integrate well, because I'm imagining just through training, Alyssa, you would have been around a lot of naturopathic doctors with different perspectives on conventional medicine. And then Michael, you're obviously around surgeons and, other conventional healthcare providers of different kinds. And how has that worked out for you all?
I would say from Alyssa hanging out with surgeons, there is this stereotype of surgeons being a bit socially overbearing or awkward and tough to interact with. There's a few of my friends who fit that bill, and Alyssa is never thrilled when we have to hang out with them. But I think me and Alyssa work because we have very similar interests and personalities, and by extensions, the friends we make tend to be like-minded, and so I don't think we actually have too much trouble with friend groups. I remember you tell me about some of your classmates who I would find it very difficult to hang out with, but you also found them difficult to hang out with, and so we never actually hung out with them. Yeah, and then I tell like my classmates who was so sure of themselves and their path that they would have been mean or dismissive of you, but there's also like not people I gravitate towards, and so we never hung out with them either. So I think we're very similar in our laid backness and our insistence on being kind and just genuine good humans, that our friends are very similar and pretty easy to hang out with.
Mm-hmm.
Back when we had friends before we had kids.
Yeah.
When you had a social life.
Yeah. Once upon a time.
Do you feel like there are things that you wish your world understood about your partner's world? Are there things you wish naturopaths understood about conventional medicine, Alyssa, or are there things that you wish conventional providers understood about naturopaths, Michael?
I mean, I think overall, one of the most challenging things about a conventional doc when they see any sort of naturopathic recommendations is a lot of times it's just not the same language. And so there's not the familiarity around the herb or the supplement or whatever the thing is. And I think if we had the opportunity to collaborate more, or if there was more of a
Like a cross-pollination.
yeah, or like the opportunity to send my notes to sort of explain my thought process around whatever I was doing, and that I am evidence-based, and that I do try to do the least invasive treatment option, and I'm not just sort of picking something random or dangerous, so that they are more comfortable around whatever it is that I'm offering. I mean, do you wish there's something from your perspective?
No, kind of like we were saying earlier, just working in Southern California, which I think is one of the hotspots for naturopathic medicine. Professionally, I come across naturopathic doctors increasingly rarely. Like, just for what I am doing and I am entering myself in the disease process, we've kind of left behind the island of preventive medicine.
Yeah, it's a different space. I mean, I think I wish more NDs, and I don't want to say that they don't appreciate MDs, but there is a tension. I think that goes both ways. And we have the luxury of time. And I think that's fairly well known, but it's true. I mean, the system doesn't allow you guys the same opportunity to get to know people and to spend the time doing the type of counseling that we do. And so, especially your specialty, like incredibly grateful for what you guys do and the time that you put in and the training that you've had to do to get to this place far exceeds what I have to do as a naturopathic doctor. So there's just a level of respect for that ability that I think doesn't always get verbalized.
Mm-hmm. Yeah. And I think it's hard too when, although the classes may be very similar in the first 2 years of medical school, then when the clinical experiences really start to diverge, it's hard to have an understanding of the other person's world unless you've been in it. And it sounds like, whether because of your own professional experiences or just being involved with each other as a couple, you've had a window into that a lot of healthcare providers on either side of this equation wouldn't have. I think a lot of naturopathic doctors have very little exposure to high acuity cases and what it really takes to save a life, for example, and to act quickly and decisively, and kind of the heroic measures that have to be employed when we've kind of gone way beyond the scope of preventative medicine, and now we're into, okay, we've got to keep this person from falling off the cliff at this point, and vice versa, because of the the way training is for conventional docs. I think, like you mentioned earlier, we don't have the time to actually sit down and get to know our patients. The system doesn't support longer appointment times. Reimbursement model doesn't support it. And a lot of the good that we could do, even in primary care on the conventional side, I feel like is stifled by the reimbursement structure and the healthcare system not being designed to support that level of granularity and rapport building that really can make a difference for people. But you guys get to do that part, which is wonderful. As Alyssa and Michael continued to pursue their respective paths in the field of medicine, they each got a front row seat to the other's experience. I asked them how their postgraduate training programs compared.
Naturopathic doctors are not required to do a residency, and I did not 1, but 2 years. I would have done a third, but I was pregnant and we were commuting at the time to make it work. But as far as, I guess, what surprised me with Michael's training, the rumors are true. It's hard. It's long. He regularly will not see our kids for a few days on end. I don't think anybody goes into a general surgery residency thinking it's easy, but seeing it and watching him fall asleep while he's working on notes on the couch at night, night after night, preparing every year for the big test that they all take every year, and just constantly kind of preparing for the next thing. Just incredibly proud of him. And just really, it's as hard as they say.
Let's talk about, why did you do a residency then if it wasn't required?
So I chose to do a residency because the idea of doing 4 years for the ND, 2 of that being didactic, so primarily class-based work, and then the second 2.5 incorporating the clinical time, I didn't feel nearly prepared enough to go out and actually treat people. And honestly, when I graduated from residency, I had a job for 3 years under a medical doctor who specialized in hormone care. I think most NDs, really all NDs if possible, should do a residency, because I don't know how you can be prepared to treat patients with only that 4-year degree. There are currently not enough residencies available if everyone wanted to do one, and oftentimes they're only a year long.
There's also no reliable funding for those residency spots like there are on the allopathic side, because I think the average person listening to this may not know that the government essentially sponsors the residency training spots across the country for conventional physicians, and there is not funding or a program like that for naturopathic doctors, and so the residency spots are funded by the clinics that sponsor those spots, which is tricky because when you're coming out of medical school and it's your first day of residency training, you're not really ready to hit the ground running. So you're not a profit-generating individual. You're really there to learn and observe and to gradually have increased responsibility over time. And so because naturopathic doctors tend to work in small private practices, most of the time the residency spots that are available, besides the very few that are available at naturopathic medical schools, they are most often at these small private practice clinics, and those private practice clinics don't have a huge budget to sponsor education.
Right.
So it creates a gap in the ability to provide residency training for naturopathic doctors. And then it's also not systematically institutionalized the way it is in the conventional side.
Agreed. It's not expected. It's not automatic.
Right. If you don't do a residency as an MD, it's extremely hard to get a job. I mean, there may be a job out there, but it's not the kind of job that you would want. And unless you become board certified by doing a residency, it's sort of like you're risking your career and all of the money that you invested in your training, basically.
Yeah.
So for naturopaths, it's not the same. And it's a choice to accept lower pay and to stay as an apprentice and to continue learning. And so the incentive isn't there in the same way, perhaps.
And just the standardization, I think, of training. We don't have the same level of board certification after completing, let's say, a residency. So it's tough.
Mm-hmm. Yeah. It's tough. And then the other thing that's tough about it too is a lot of the deferred gratification that is experienced by MDs. We delay having a quote real job for so many years with the thought that once you get done with your training, someone will hire you and you'll have a salary and you'll be able to pay back your debt, and all of the sacrifices that you made financially and with your time will be rewarded. But it's a little tricky as a naturopath because there's just not a lot of salaried jobs out there. You kind of end up joining a practice and becoming a partner, but you're kind of, you're having to see patients to guarantee the income that you're making. And it's not easy to build a practice. It can take time. So that's kind of tricky too.
Then what is the solution for the funding of the residency program? Like, you can't tax the average U.S. citizen to help subsidize naturopathic residency programs when the average U.S. citizen doesn't know what a naturopath is. But that's a big chunk of money to make enough spots for every naturopath graduate to have a residency program.
Yeah, I think it really would take a commitment at the federal level to recognize naturopathic medicine on equal footing to MDs and DOs. And I do think one of the things that could tip the balance in the future, I don't think we're anywhere near that, but is the shortage of primary care doctors. Because I do think naturopathic doctors, because they do pretty much exclusively outpatient medicine, many are generalists. The training, even in medical school, is in community clinics where you're in a primary care setting. And those that do take insurance in Oregon and Washington, I'm imagining, are primarily doing primary care. Is that correct?
Mm-hmm. Yep.
Yes. So if we decide as a country that we are going to recognize naturopathic doctors on the same level as MDs and DOs in the wake of this primary care physician shortage, which is becoming an increasing problem, I do think that there could be political pressure to create that parity and to fund spots to train naturopathic doctors in primary care. Physician assistants and nurse practitioners are, in many states, and it's sort of state by state, being elevated to a level of independence that's closer to a medical doctor. And in part, it is a response to the shortage of primary care providers. So it's to help fill that void. And I could see something similar happening with naturopathic doctors, with the right leadership and the right people working across the aisle to collaborate and potentially funding more primary care training spots that would allow naturopathic doctors a pathway into primary care if they wanted to do that. It would have to come with pay parity too. And we've seen that with physician assistants and nurse practitioners too. Actually, on the last podcast episode, I interviewed Amber Supanzik-Albin. She's a healthcare attorney that practices in Oregon, and they had a recent parity law that essentially mandated nurse practitioners be reimbursed at the same rate as MDs. And so there is precedent for that kind of thing actually happening, but I think it will take aligning the incentives around better access to primary care services, which I think NDs are very well suited for.
And studying outcomes. I think that's probably what will get the most response, like actually studying what do the outcomes for naturopathic doctors in primary care look like.
The medicinal traditions used by integrative providers have been developed over centuries before modern research techniques became the norm. They originate from a time in history when practitioners learned through practical experience rather than scientific trials. The research on these medicinal traditions is starting to catch up, but in the meantime, there are many misconceptions. I asked Alyssa to share with me what some of these misconceptions are, and to write the record.
Michael's various colleagues will always ask me about remedies. That's the word they always use. Remedies. I don't know.
What does that mean to you versus what it means to them?
I think they think I'm like a little witch with like my cauldron brewing up some sort of potion.
And how would you explain what you do?
Well, I also think, so remedy is also a pretty common word when we're talking about homeopathic medicine. Remedies is kind of the vernacular for that type of medicine. And I don't do homeopathy. I'm not against it. It's just not a part of my practice. But I do think people tend to associate naturopathic doctors with homeopathy sort of interchangeably. And maybe this is a point where I can kind of say that's not necessarily the case. A lot of naturopaths do homeopathy, but not exclusively. Naturopathic doctors can encompass all sorts of things. So it could be botanical medicine, supplements, nutraceuticals, dietary and lifestyle modifications. It could also include physical medicine modalities, anything from craniosacral to acupuncture, you name it. Also homeopathy. And the way that naturopathic doctors practice also varies. So not all naturopathic doctors use botanical medicine. Similarly, homeopathy, some gravitate towards one modality more than the other. Some don't prescribe any prescription medications at all. The type of practice can vary widely, but it's not accurate to say all naturopathic doctors do homeopathy, for example.
Mm-hmm.
Yeah.
And can you tell us what homeopathy is?
Homeopathy is more of an energetic medicine. So there's different ways to prescribe it, either constitutionally, where you're focusing on someone's sort of constitutional presence, and then there's remedies specific for those different constitutions. And it's delivered different ways, but primarily through pellets, and there's sugar pellets that come in these little vials. And there's different strengths of those pellets. And so you choose the homeopathic remedy for the patient based off either their specific presenting symptom or concern, and it's specifically tailored to them based on whatever that might be.
How does that fit in or not fit into evidence-based medicine?
I do think homeopathy is a bit of a point of contention because it is not well studied. And so I think that is a modality that conventional providers tend to, in particular, take issue with. And it's not new medicine by any means. It's been around for a long time. But it does fall into more of the energetic medicine, which we don't have a lot of data for. So I think that's why it can be harder for conventional docs to understand.
What's interesting to me is that acupuncture, I feel, is more widely accepted by the conventional medical community. And in a way, it is a form of energetic medicine, I would say.
Yeah, I agree with that. We have a lot more data on it. I don't know if it's been around longer, but I would guess it has. I don't personally do acupuncture. Previously, the school that I went to did offer a dual degree, and they offered it previously as more of an add-on where I think it was maybe a year longer for your program to add it. And now you need the full either doctorate of Oriental medicine or what have you to add it. So for me, it wasn't realistic to do the 4-year ND and then add another 3 or 4 years to get just the acupuncture piece. But there are a lot of NDs that do both and combine that, beautifully in their practice. I think it complements the naturopathic world well. But yeah, personally, I don't do it.
How do you feel integrative care should be utilized in the United States? And what are the barriers that exist today in the U.S. healthcare system for allowing that way of utilizing integrative care?
I think what you said earlier makes a lot of sense, that there is a need for more primary care physicians. And I think the people who go to naturopathic school have self-selected to be outpatient. And so I think you have a population there that's motivated, young, and intelligent that want to do outpatient care. And I think allopathic medicine, who has a population of young, intelligent people, are struggling to find ways to motivate them to do outpatient care. And so I think it makes a lot of sense to make naturopathic part of the primary care army that America needs. And it could be family medicine, it could be PCP, it could be internal medicine, it could be naturopath, it could be NPs and PAs. And I think even with all that, we still fall short of the need we have for primary care, but it would help.
I think if you created a pathway to go from naturopathic medical school into primary care with pay parity in an insurance billing model, I actually think it would make naturopathic school more attractive. And I think you would have more applicants because there would be a clear-cut pathway to a real job at the end of the program versus having to figure out how to start a private practice and, to focus on these kind of boutique areas of medicine that may not be serving the broader needs of the patient and also are only accessible to the people who can afford self-pay rates.
Yeah. And I think that's sort of the recurrent theme or frustration that I've had being in this field is just access. We tend to be in private clinics. It tends to be cash pay, not just the visit itself, but what we prescribe or treatment plans. Supplements aren't typically covered. I mean, yes, people can use HSA and FSA to some degree, but it's just very expensive for the average person, which is unfortunate.
Mm-hmm. And I think there might be a misconception among the general public that naturopaths choose not to take insurance. How would you respond to that?
Oh, I mean, I would love it if I could take insurance and be sort of funneled, I guess, those patients and the access to more people. I absolutely would. That structure just doesn't exist right now.
At least not in California.
Correct.
And
But even in Oregon, where they're credentialed with insurance companies, I have a lot of colleagues back there who have either started that and left it because it just wasn't even covering kind of their basic financial needs, and have transitioned to private practice even in the full scope states.
because the reimbursement was not equal to that of MDs. And so it just wasn't financially viable as a business model.
Right.
I mean, even for MDs, the reimbursement in primary care makes it difficult to survive.
Yeah.
Never mind if it's lower than that.
Yeah. Well, and a lot of the ND schools have a large sort of business training component to it, because the reality for NDs is a lot come out and have to start their own practice. So you have to now be a new doc and also a business person trying to start a clinic. So it's a challenging path.
Mhm. So here we are in a day and age in the United States where I think there is quite a high demand for integrative care. Just even the fact that Peter Attia's book was so popular and has sold millions of copies, I think that also signals to me that there is a demand for circling around to more of a focus on prevention, which is good for everyone. It's good for lowering healthcare costs. It's good for patients' well-being. It's good kind of for all sides of this equation of our healthcare system. If we can catch illness on the front end instead of waiting until it's too late, that lowers costs and it helps people stay healthy. And so I'm just wondering what you think is driving this disconnect between the demand of the general population for more wellness-oriented care and the lack of ability to access that care through the reimbursement models and whatever other regulatory barriers there are.
I mean, truly, I just think it's the lack of insurance coverage, because if it's not covered by insurance, people aren't necessarily going to pay out of pocket for it, even if they're interested in it. I think it's out of reach for a lot of people. So if there was insurance coverage that could offset that for folks to some degree, or at least provide the option to get that second opinion, and if that were built into primary care or family medicine practices where there was that naturopathic doctor that could offer sort of the second perspective or the alternative perspective on whatever their concern is, that would be much more, I think, approachable for people. But purely cash-based, I think, is just cost prohibitive.
Mm-hmm. Even if it was the same as what insurance would reimburse, so just call it $125 for a visit, I think even that can be cost prohibitive for most people to be able to pay out of pocket for ongoing care.
Absolutely.
So,
and people should have access. I didn't even hear about an ND until I was in my 20s and could have benefited greatly had I known about this type of medicine sooner.
what style of care is best for patients, each from your own perspectives?
Define style of care.
I think that the style of care speaks to both kind of the perspective and philosophy that it comes from. Disease-based care, you have this particular illness that we've diagnosed and we're going to figure out how to treat it, versus whole person care, which is you're an entire human being and we're going to address all the things that come together to help you function at your highest capacity from a health standpoint.
To be honest, that feels a bit of a false dichotomy to me. When you have something like gastrointestinal stromal tumors, where there's only 4,000 cases a year in America, you can't expect a whole person provider to have the level of expertise to appropriately treat it. They're like, oh, look, second person I've ever seen with this disease in the last 25 years. And so then you find yourself going to people who are the experts in these things. And then you can't expect to come see Dr. Siklik, who's a world-renowned expert in GIST, and then, okay, but I also want to talk about my hypertension. And he's like, well, I've made my whole career studying this one super rare disease. I think patients do better when we look at them as whole people, complex people with competing motivations, and we acknowledge that. But I feel the patients come to me for my expertise in questions of surgery, and I give them my best information, but I try to empower them that you alone know your value system, you alone know how all this fits in. When patients have some complex medical histories and they have multiple specialists talking to them, they didn't go to medical school, they don't understand how all this plays in. And so having somebody like a PCP who could help keep perspective and balance out competing specialist views. But then when you do have that rare disease, you want to see the world's expert who this is the only thing they do with their time, this is the only disease they treat, because that's how they're going to get the best outcomes.
I think that's a really great explanation. I think it is a false dichotomy. In the medical community, we tend to see things through the lens of that false dichotomy. There's just a lack of understanding and a lack of appreciation for the different skill sets, and they all contribute something. And I think by knowing more about each other's worlds, we can all do a better job.
Yeah, I agree. And I think sort of what came up for me with that question was just a lot of times people will come to me for my perspective and I'm telling them to take the prescription or, whatever the thing is that they have questions about, because I'm still a doctor looking for red flags and assessing severity and risk in every visit. And sometimes conventional care, standard of care, what have you, is what makes sense. And I hold that responsibility of being kind of the voice of integrative medicine. I take that seriously. And sometimes I'm talking about other options, but if standard of care is the best option for them, then that's what I'm going to recommend. Right? So.
Mm-hmm. And when we say standard of care, what we mean is the conventional treatment pathway that would be recommended by a medical doctor.
Mm-hmm.
As our conversation came to a close, I asked Alyssa and Michael the question I ask all my guests. Despite all of the challenges in healthcare, what keeps you inspired?
I would say I just really enjoy my job. I get to help people. I'm specializing in cancer surgery, and those are battles that you don't often win, but you get to give somebody just a few more months or years of good life.
One more birthday party.
Yeah, that stuff is very important to me, and I find very difficult but fulfilling.
I think what keeps me inspired is when I have the follow-ups with patients and they're better. And that sounds kind of maybe simple. One of the reasons that I gravitate so much towards the bioidentical hormone replacement world is that when you have a peri or a postmenopausal female and you get her on the right hormone replacement, it is absolutely life-changing. It can really change that woman's life and their family's life and the whole sort of community around that woman, getting her back to sort of the baseline that she was used to her whole life. And so having the opportunity to do something where I give someone back that capability to function again is why I continue to show up and do this, even if not everybody has access to me. And I'm working on ways to provide greater access, if it's training other providers to do what I do who maybe do have insurance coverage, or speaking on podcasts where we bring awareness to different types of medicine. But I think just healthcare in general, having the opportunity to affect someone's life that way is really meaningful and very fulfilling. That's by far the best part of what I get to do. I think if you would like to have an ND and you don't think it's fair that your insurance won't help cover the cost of it, then advocate for it. Push the health systems to bring them on board. Vote for the issues that you care about. Actually know who your local politician is. Be involved as much as you can. The average person is what's going to make the change. It's just we have to make it a collective effort.
Thank you for listening to Your Doctor Wants to Quit. I'm Dr. Joy. a board-certified emergency physician, and I created this podcast because I'm on a quest to fix healthcare in America through conversation. If you liked what you heard today, please follow this podcast or find me on Instagram at drjoymd. That's DOCTOR Joy MD.